Meet Rose. She is an 81-year-old who fell a few weeks ago, leaving her afraid to leave the house. She received physical therapy and regained some of her strength. However, her insurance-covered therapy sessions ended before she could recover the mobility and confidence she previously had. Rose is sad and discouraged that she still cannot walk without a walker. I miss seeing my friends at book club. I know I'm supposed to do exercises, but I can't remember how to do them. Meet the healthcare team. Mary and Dr. Jacobs. Mary is Rose's physical therapist. Mary is concerned because she can no longer work with Rose. She gave Rose some exercises on paper to follow, but Mary is sure Rose will not do the exercises without better guidance and motivation. Rose's doctor, Dr. Jacobs, emphasizes how important continuing exercising is to preventing another fall. He is frustrated because he lacks time and training to customize a program or review the exercises with her. He simply prints more handouts. Meet Ellen. Rose's daughter Ellen lives 100 miles away and is worried about her mom now that therapy has ended. What if she falls again? She'll never do the exercises without me there to remind her. I wish I could help her more. Rose, Ellen, and her doctor and physical therapist want the best for Rose. Unfortunately, the best intentions may not be enough. Without extended therapy, Rose doesn't completely recover from her fall. Instead, she gets progressively weaker, causing a downward physical and social spiral. Soon, she gives up her social activities and hires a person to help her cook and clean. Ellen calls Rose often to see whether she's doing her exercises. Rose doesn't want to be a burden, so she fibs and says that she's doing fine. Ellen feels guilty. Rose feels even more alone, forgotten, and frustrated with her growing dependency. Soon, Rose and Ellen are forced to consider institutionalization and the cost, complexity, and impact on quality of life this brings. Rose's situation is not unique. The U.S. population is aging. By 2050, the population over 65 will, for the first time, be larger than the population under 18 years. Meanwhile, the elder care workforce is dwindling and will be unable to keep up with the growing demand. We need to extend the reach of existing elder care workers, support caregivers with better tools, and most importantly, empower older adults to participate in their own care. Welcome the newest member of the elder care team, Engage, a simple yet powerful tool that connects caregivers, at-risk seniors, and health professionals to enhance existing resources. Designed and tested with therapists, doctors, and older adults, Engage combats the downward spiral of frailty and isolation by empowering seniors to implement daily therapy routines on their own. Let's reimagine Rose's story with Engage. With Engage, Mary customized an in-home rehabilitation program for Rose, selecting from a set of simple yet clinically effective exercises from the National Institute on Aging's Go for Life program, like standing up from a chair. Mary adjusted the frequency to twice a day and 5 repetitions to match Rose's tolerance. Mary then wirelessly sent the tailored electronic regimen to Rose and Ellen's device. With Engage, Rose easily scheduled reminders when to exercise. No longer confused, videos and instructions guided her through each exercise. The program intensity automatically adjusted up or down based on her rating of exercise difficulty. She received weekly progress reports and shared them with her family and doctor. Through Engage, Rose connected to her grandchildren and friends through her social network, and soon Rose received motivating and encouraging messages from them. Instead of nagging, Ellen worked with her mom and connected her with a broader social network. Ellen and her grandchildren were notified each time Rose completed a session, prompting them to connect with her. Her mom's weekly progress reports also set her mind at ease. Dr. Jacobs viewed Rose's progress reports from her device during their visits. This allowed him to detect and address early declines in her tolerance before she had another fall. When Rose's shoulder arthritis began to flare, he quickly and easily sent her one of Engage's pre-selected programs. Worried older adults won't use technology? Well, don't. Studies show that older adults are rapidly adopting technology, especially when a technology is adapted to them. Engage is designed with seniors, and Engage can be used with TVs, text messaging, voice messaging, and other familiar routes. Engage can be applied and tested in numerous settings, including doctors' offices, therapy clinics, home health agency, nursing homes, senior support groups, and many more. Engage makes it fun, easy, and socially rewarding for older adults to implement therapy into their daily routine. Engage unites the older adult, their friends, family, caregivers, and the healthcare team to extend the impact of limited resources, bringing life and love back into the home. To find out more, visit www.engageget.com.